And I'm really privileged today that we have all motivated persons who are keen to work for the old age care. And that is one thing about which we have been trying to work for all these years, almost maybe 3 decades now or so. And I'll just like to share a few aspects which we feel that they would need to be discussed during our meeting today. So I'll first start with the basics. What are the problems which we are facing right now? So we all know that India is aging and it is aging quite rapidly. And there has been a demographic shift with more and more older people in the population, which poses many challenges, may it be related with the health, social, or financial or so. And this demographic shift has been possible because of the increased life expectancy, which has increased from, say, 32 prior to independence to nearing 70 at present. And the birth rate has declined from almost around 4 or 5 to around 2 or 2.5 or so at present. So this has changed the proportion of the older people in the population, and there has been changing family structure because of the migration of the youth for for their job, or from rural to urban migration, etc. is happening. So what is what challenges this aging population brings is because of more and more chronic diseases are there amongst them, may it be cardiovascular disease or neurodegenerative or bone problems or diabetes or even nutritional issues because of various factors which may be related with the food availability. They are not aware of quality of food, or dietary restrictions because of mainly because of the oral issues, because they tend to have problem with chewing, swallowing, and that is a very common cause of nutritional deficiency in this age group. Mental health concerns are also very important in them, like depression, anxiety, cognitive decline, because with the time they lose memory, they lose the ability to think properly, and the mental health care facilities are also inadequate in our country. So now with this proportion of ailments which we are facing in this particular age group, the healthcare infrastructure which exists in our country has some issues, because most of them may not have an access to the care because of various reasons, may it be because of their mobility or financial issues. The facilities catering to the older people or the geriatric care facilities, they are but inadequate. There are adequate number of healthcare professionals who are trained in geriatrics. Recently, last week, I was in a conference with the hematologist, and when few of them just asked whether do we have any geriatric specialty in India also. So the people are not aware of this, and they're not trained. There are not many healthcare professionals are trained in geriatrics also, and of course the out-of-pocket cost would also cause issues with this. So there has been lack of geriatric specialist training. We'll see how it is being addressed in our country now. Because of the age, they have difficulty in navigating the healthcare system also. May it be because of the complexity of the healthcare system, because of the physical barriers of going to various places at a time, communication barriers are there, and there are not many coordinated services available for them. So what we need to do at this particular point is that we have to strengthen the geriatric healthcare infrastructure. For this, Government of India started a national program for healthcare for elderly in 2011. We started advocating for that sometime in 2000, late 90s or 2000 itself, and ultimately a national program was launched in 2011, wherein there has been provision for increasing training facilities for the geriatrics, also creating geriatric units even at the sub-center on PSC level. So this program is trying to address this particular aspect. However, over the last almost being in there for last 13 14 years, the reach has not, it has not accomplished its goal of 100%. Still lot remains to be said done for this. And for the rural outreach also, there are being programs being prepared right now with WHO. We are having one program, ICO, that is integrated care for older people. That is a very simple program by which we can have a reach in the community, while the organizations like we have in Gwalior, if all the older people, they can assess by themselves their health status by this particular screening method, and then the planning could be done for their management. Personalized care could also be planned. Now, with this, there is one important challenge with the old age, is that all the ailments are not curable. Many of them lead to lot of disability and dependence. Now, in old age care, we always try to maintain the functionality and independence of the individual. Now, this dependency causes trouble, because in that case, you need somebody to help for your management need. So it has been found that in the study that almost 11% of the individuals in India, through this record is from a very prestigious longitudinal aging study of India, LASI, which is an ongoing population-based study, where we found that almost 11% have some or other impairment of activities of daily living. And with this ADL limitation, around 25% need helpers. So this indicates the magnitude of the need for long-term care in India. Unfortunately, our system is not organized for long-term care because of shortage of trained personnel. The geographical area is so vast, so different terrains and different cultural areas, places have a different way of dealing with the old age. So this particular thing needs some support. We'll see that there are fewer long-term care facilities over here. The cost is more, and quality is always a concern for these care. So the issue which TVG mentioned, that we should have a home-based care, that is very important, because we want everybody to age at home. We do not want them to come to the institution and be there. But the problem in our country is that there are limited availabilities of these services. This is one area where a lot remains to be done. The people are not trained for home health care. So this training part remains. And of course, since the cost for the home-based care has to be borne by the individual, the cost financial barrier is also an important problem. So this is one area where we can try and discuss this particular issue. Family remains the main backbone for the care of the individual. And for this, we have found that the informal caregivers, the family members who are taking care of the individuals, they take most of the responsibility. This has been shown that almost 85%, that this figure is from US, it is probably much more over here, who are the family members who are taking care of these individuals. 72% of them are female caregivers. So there is a gender issue over the caregiving. And even amongst the caregivers, 33% are those who are already themselves older. So because they usually spouse taking care of this, the other spouses, or spousal caregivers are usually old or so. So now this issue of women as a primary caregiver, where she has to balance both caregiving and work, that remains to be addressed. And there is a financial burden on family because of the caregiving, which accounts because of the healthcare expenses or the caregiving cost or even the long-term care costs are important. So we look at it that the informal caregivers have lot of challenges because more and more complex management systems are there for the managing patients, and trying to learn about them and uh, implement them at home itself is an important task. There's no training and facility for these family caregivers, and that is the area where our caregivers Asha society has been working for last few years, that we try and address this particular part of training the family caregivers about the needs of their loved one. And of course, this family caregiving takes their personal toll, may it be related to their job, may it be related to their finances, etc. So caregiver burnout and stress is another important area where we have to try and work on to take care of their physical and emotional strain, work out their financial issues, and support them in whichever way. It could be by way of respite care or by way of some community support that we try to support them. So this particular aspect is important, which we need to discuss, that what are the ways where we can support informal caregivers, maybe by integrating their part. As we are advocating, as in our society, we are advocating inclusion of this care of the basic ADL in the UHC, universal health coverage, that it should become a part of universal health coverage. This is one advocacy which we are trying to do. We need to have person-centered approach and trying to work at the need assessments for the long-term care or so. So strengthening the family support system is an important area where we need input from everybody, where we increase the participation of the family members, and we look at the working caregivers, providing them some flexible working system or some way by which they could balance their work and the caregiving together. So now, for improving the caregiver training and support, we need to have caregiver training programs. Our society is also would be launching one program soon, a accredited program. Otherwise, we are trying to give training right now individually for the family caregivers. There is a need to establish more and more caregiving training centers across the India country, because Skill India has a provision for that, and we need to advocate right now. Surprisingly, for that particular program, while other Skill India programs are running in thousands, only 16 places are there where this caregiver training program is going on. And from there also, the report is that it is not being promoted very well. So, and there has to be some incentives given for the family caregivers about which advocacy has to be done. I feel that let us try and work out for getting the care products at a cheaper rate. Why can't we have an adult diaper subsidized, like we are providing other products, subsidized products. So adult diaper is one more thing. Assistive devices are other where one should have tried to work on. So there is a need for investing in long-term healthcare infrastructure, maybe by funding, improving quality care by training people or expanding facilities. In addition to this, what is peculiar to our place is the challenge of rural and urban setting, because more and more older people are living in the rural setup where the healthcare facilities are a bit less specialized, and the transport access, etc., is an issue. So, and in the old urban area, because of the living conditions are difficult, the high cost of living is there, overcrowding is there. So there are other challenges in that setting. So, and as I mentioned earlier, the geographical terrain also of our country poses a major challenge. We cannot have the same system which is existing in Rajasthan working in northeast, or what is there in the north working in the south or so. So In addition to this, I really appreciate the program which is being run in Gwalior. That community support is very essential for the old age care, because this community resource can take care of so many things. It could help the caregivers. It would support the old persons to communicate, and also get a confidence of living. So this is one area which needs to be worked into. There are certain social issues with the aging, which is called ageism. When we discriminate somebody on the basis of age, which may be related with social isolation because of the financial dependence or discrimination or so, that also needs to be addressed. And we need to work on this by having community engagement. Mental health services have to be increased. Elder helpline has to be placed in there. Government of India has got certain programs about which we'll talk sometime later. Financial constraints we have mentioned, that healthcare cost and other, and the government assistance programs which are existing. There are several programs where the old age pension is there. There are programs where they are providing food or grains to the older people or so. But the problem is that people are not aware of them. What I saw in our day-to-day working also in the hospitals, that the social programs meant for supporting the older sick persons were not known even to the hospital administration. So the patient would come to the hospital, and I'm not aware of those programs, so I won't tell the patients about that. And that's why this lack of awareness also leads to lack of utilization of those schemes. Also, there are other bureaucratic challenges, etc. So, and as it's very universally known that the insurance coverage is not there, so we need to work to have some promote financial security for the older people, may it be by having pension schemes or insurance support or subsidizing the products which we mentioned. Transportation and mobility issues as another important challenge for the older people because of the physical limitations. Our facilities are not age friendly most of the time. Only few of them are would have an access for a person on a wheelchair or so. So, and safety concerns for the older people is another problem which is being addressed by the police authorities also right now. So that is another challenge. One important challenge which is there is technology gap for the older people, because they do not have adequate digital literacy. That is one issue. Their You'll see the old person who is good at social media engagement stays healthier as compared to the one who says that I do not know how to operate the mobile and all this. Internet access has a challenge. And I like to show you this Care Asha app you could download right away. Is an app meant to support caregivers, informal caregivers. We try to empower them with the knowledge, and also a provision for recording their data to help them manage their conditions better. There are screening tools by which they can look at their own health by those two tools also. So this particular app is available both on App Store and Play Store. Okay, so we have to have technology for assisted living by way of using smart home technologies. Telehealth could be used, and digital literacy is to be programs have to be there. Then, when it comes to when you look at the differences in the challenges, one important place where we find is the cultural belief and end of life care, because this end of life care has got a lot of cultural connotations, and we have different the old person in our area has a different needs as compared to other places. So cultural issues have to be looked into, and we have to try and include palliative care in our management so as to make things easy and better. And we have to talk about end of the life also with the public, because we are not talking about it. So the people are not aware that how could they improve that particular aspect or so. So there is a need to set up more and more palliative care centers. The providers of the end of life care, they need to be trained in that particular part, and also the community based services have to be there. So this is one more area where the challenges are there, and there is a need to intervene also. There are certain ethical and legal issues for which already there are certain legal protective acts have been enforced in India, like Maintenance and Welfare of Parents and Senior Citizens Act, and there are policies which are there and programs which are there about old age care. But as I mentioned, that awareness issue is there. So when you look at the policies which are existing in India, it all started in 1999. It was with after the Madrid Declaration of for the aging people. The government of India was the first, one of the fewer countries who started developing the national policy. And I tell you, this is a very exhaustive and up to date document which includes almost every aspect of the old age. But the problem is that it has not been implemented. It has been only in the books and papers. It was only in 2007 that the Maintenance and Welfare of Parents and Senior Citizen Act was introduced. I have reservations about this act because this act is lopsided. It does not account for the needs of the caregivers. It just looks at one particular angle. 2011, as I mentioned, national program was started, which is already going on. And in 2019, they had revised the Maintenance of Welfare Act. Then after recently, a Atal Vayovrant Yojana has been launched for supporting people above the age of 75 years or so, where they are provided the health care also. In addition to this, the Ayushman Bharat has recently announced, which is probably the biggest insurance which has been announced for older people, irrespective of their income bracket. Everybody has been insured for 5 lakh for the health care in the Ayushman Bharat. So that is such a big event which has happened in India. So now there is a need for having policy reforms. We strengthen the laws, we integrate care models. Now here, when I say integrate care models, I'm trying to talk about the long-term care. As I mentioned, that we have to include long-term care, particularly the care of ADL, activities of daily living, in the universal health coverage. And we have to have some way of monitoring system for the long-term care. The quality monitoring of long-term care is a very difficult task, but still we have to find a way out for this. Now, we have to promote awareness and advocacy by having public campaigns and by having educational programs. I'm happy to tell you about the Future Caregiver initiative, which the Caregivers Asha Society has been running, as we go to the schools and try and talk about the old age and the problems related with old age and what are the benefits they will get of caregiving. And there is a need to include it because in syllabus, at least I know of Rajasthan, that during schooling, this particular topic is never talked about. So we need more and more CSR engagement for conducting these things also. And there is this type of program promotes intergenerational collaboration, and as has been exemplified by the Gwalior example, that there is a need for intergenerational collaboration that works both ways, that helps both the people. And there is a need for more and more collaboration of NGOs and community groups to develop public-private partnerships, having volunteer networks or volunteers, and are creating awareness through media. Research and innovation has to be there because that is the only way we can improve our things. We can develop newer models. So we need to innovate in this particular sector because care is a universal thing which has been existing throughout life from the day of mankind, basically. But now the idea is to innovate ways in the present setting. How could we deliver it to the more and more people? That is what is important for us, and we try to find out innovative elderly products or assistive devices or ways with AI coming into picture. We can have that also included for the care of the older people or so. It is always better to learn from others, and I can tell you that very good programs exist in Japan, Scandinavian countries also, where we have programs where the social care support is being provided. uh, Germany has got a good program with the old age so there is a need to for having adopting those practices. WHO with its under the UN Decade of Healthy Aging, which is going on right now, has got uh, has picked up two areas: integrated care for the older people and also the long-term care. And we are trying to work on finding ways to develop systems which could be adopted at the policy levels in the countries, and which could adapt cause give a quality services to the older people. So, dear colleagues, I just want to tell that we need to have some holistic solution for the geriatric care. It won't be achieved by one individual or one organization. There is need for to work together for this particular cause, may it be government, private sector, or community, and that will only lead to a good, sustainable healthcare system for older people, improving their quality of life, and also taking care of the caregivers, because we are definitely looking for them also, because without them the old age care won't be possible. Thank you very much.